We'll now move on to the fourth and the last session of the National Symposium on Yoga and Naturopathy, conducted by Ynysch Naturopathy and Yogic Science College and Hospital. In the fourth section, we have with us as a speaker Dr. Vijaya Banu, who is the assistant professor and head of the department in the Department of Psychology, Chennai. She'll be addressing us on the topic Psychosocial Factors Affecting COVID-19 and its Management. It's a pleasure to have you, ma'am. Ma'am, I welcome you to the session. And I request the Dean and Medical Superintendent of Ynysch Naturopathy and Yogic Science College and Hospital, Dr. Naveen, to introduce ma'am to all the participants.
Good afternoon, everyone. Good afternoon, madam.
Yeah, good afternoon, Naveen. Dr. Naveen, yeah.
Yeah. Dr. Vijaya Banu, she's a good friend of me. In fact, she was my colleague at Chettinad University, Chennai. She's an expert in counseling psychology. She has got PhD from University of Madras. Prior to that, she got her Masters of Philosophy in Psychology with thesis on Environmental Psychology, Master of Arts in Applied Psychology with specialization in organizational behavior, industrial psychology, human resource development, and organizational counseling. Her PhD thesis was mainly on influence of individual factors and coping with change on organizational commitment and job satisfaction. She was awarded with one of the best theses in international conference organized by Department of Management Studies, IIT Chennai, which is a renowned institution, as all of you are aware of. She has more than 30 papers in national and international journals. She has presented more than 30 empirical research papers in national and international conferences. She has been regularly taking personality enrichment and soft skills program for PG students at Madras University. Currently, she has experience of more than 20 years in her professional life after her masters in psychology. Currently, she has been working in one of the reputed institution at Chennai as a senior assistant professor. Madam, welcome you on behalf of our Ynysch University, Ynysch Naturopathy and Yogic Science College and Hospital. Madam has been a main source of motivation for me also as well whenever we come across some tough situations, and she has been very good in managing life skills programs and management to industrial psychology. She has been very good at it, and whenever I have some consultation with the patients, I generally whenever it is required, I will take madam help to combine my practice with her. That is how our relation has been for the past so many years, more than almost 6 years. It is pleasure that we have invited you, and many more going to come. And one more very interesting aspect is she is our co-investigator of our project which we have at Ynysch University, funded by Department of Science and Technology, Government of India, worth rupees around 40 lakhs. And many more our students are going to learn from her. It's not just a beginning. Yeah, and our faculty also as well. So once again, I thank you and welcome you, madam, to our university. Session is yours. Thank you.
Yeah, thank you so much, Naveen. Dr. Naveen, as Dr. Naveen said, it is more than a friendship. We had a very good bonding relationship of brother and sister. I treat him like my own brother because at times I used to scold him also. So thank you so much, Dr. Naveen. But here in the forum as a principal and as a medical superintendent, I should thank you so much. And I thank the management for accepting me as one of the speaker, and hope you will definitely get benefit out of it. Right? So just give me some time. I'll just put my PPT.
Sure.
Yeah. Is it visible now? Fine.
Yes, madam, it is visible. Please go ahead.
Right. Yeah. So as the name suggests, I'm going to explain to you about the psychosocial factors affecting the COVID. Now, before going into that, I would just like to start with a quote: "Is life is 10% what happened to us and 90% of what we respond to it." It is not applicable to the present pandemic situation, but it's applicable for everything. That's the reason I just wanted I should start with this, because most of the time it is how we react to it. We fail to respond to the situation, but rather we reacted. That's the reason we say probably it should have been changed as responding to it as reacting to it. And I'd like to tell a small, narrate a small incident, or probably like a story. You might have read this already. No problem. It is how I am going to interpret that. There was a lady who was sitting in a coffee shop. She ordered her coffee and she was waiting for her coffee along with her snacks. Suddenly a cockroach somewhere, it just jumped. You know, most of the women, we are so scared of, or maybe allergic towards cockroach or lizards. Hope most of the ladies who are here agree with that. The reason why I say most is that not that every girls or ladies are afraid of cockroaches or lizards. So what she did was that as a reaction, she just jumped out of a chair. The way she jumped, everything got spilled, and that entire coffee shop had become a fire of the screaming. The moment she saw the cockroach and how it jumped and how she jumped, everything was a mess. So there now immediately a waiter comes in and he's asking, "What's madam? What happened?" Then she is telling that no, I cannot sit here. She just starts screaming. She's with a lot of awareness towards looking into the cockroach, and he just came very silent, very simple. He just caught it, throw it, and the entire scene has become silent. Now this is a simple narration. Why I said is that how do I react? See, the cockroach is the same. For you, how you reacted, you jumped. You, in the sense, I am putting myself in the place of the girl who jumped and screamed and made a big chaos of the situation. Whereas the same situation, the person who came and he just calmly reacted and thrown it away. Probably you people will say that, no, it depends upon whether I like it something or I don't like it something. But the moral is that how do I respond to the events that's happening? The same way here now the pandemic is that now you cannot escape from it. Everyone is facing. how you are going to respond or react to it, that matters. Now, before going into this management, let us look into how much problems or how much issues it created. That is what the first session we are going to look into it. So definitely, there is no doubt about it. It has affected our health. It has affected our health in the sense we are talking only in terms of physical. Probably, since there are many doctors out there, you know how. Yes, any doubts? Somebody's mic is on. Yeah, okay. So it is not affecting. I'm not going to talk much about the physical health, how it is affected. Of course, we all know that the worst we have seen because of this COVID-19. But when it comes to the health is not stops. I don't explain my health only with my physical health. It is applicable to psychological health, social health, economic health, spiritual health, everything combined only we say that as a wellness. And that's where I am here to talk about how it affects my overall health. So when I say the factors which is affecting the health, it affects my thought process, it affects my emotion, thereby it affects my physical, my social interaction with the people and energy. Now let us look into these things one by one in detail. So as I said, we as a psychologist, we talk more about the body-mind relationship or the mind-body relationship. You can mind you cannot segregate body from the mind and mind from the body. Everything is together. So when thought is getting affected, your emotion gets affected. When your emotion gets affected, your internal physiology gets affected. That will result in the interaction, how you are going to make with others. And with all these things, your total energy system, like how you talk in yoga, the energy system is getting affected. So, and altogether the mind is affected, because as we say that every time I say, I feel something, something tells me something. So every time I talk about my mind, or every time I talk about my inner gut feeling or something, but you don't have any hardware to show that. It is only a software. So generally it is said that the mind, how it's connected is that I have a thought, I have emotions, and there is a behavioral tendency. I react to it. So, for example, I'm getting angered. Probably everyone would agree that you will get anger at one point of time. Maybe the reason is yourself, or maybe the reason is somebody else. Of course, hope you all agree that at one point of time in your life, at least once, you would have got anger. Yes? No? No, it is because it's very simple for me to explain. I'm just taking the emotion anger. Do you get angry? Or I'll ask you this question. Do you get angry? You can put it in the chat box. Do you? Yes? Or you can unmute yourself and you can answer. Yeah, of course. Yes. At least one has answered. Yes. Okay, right. So anger, it's an emotion. I react to it. It's maybe in a layman's term, I say that as a feeling. Anger is a feeling. I am reacting to it. I'm doing an action. With the anger, there is a different reaction for different people. Of course, there is always an individual difference. Some people, they used to slap someone. If I want to hit someone strongly, or I want to throw something, I want to bang on the door. So there is a different ways I reacted behaviorally, or I expect, or I engage myself in certain action to what I feel, that I'm expressing my inner feeling of anger in that way. After some time, most of us, what we do is that I'm thinking, oh, I have reacted a little bit over. I should have not done it. Then I'm thinking. So now it disturbs. So there is a feeling. I'm naming it as an anger. I'm acting for it. And then I am thinking. So F, feeling, A, action, T, thought process, fat, which is not good for both mental and physical well-being. Rather, there is a feeling, I'm thinking, okay, I'm getting anger. What should I do now? Should I scream? Will there be any benefit of me screaming? Is there anything I'm going to get out of banging the door? No. So the feeling, then comes your thought process. Then if it results in the action, then your well-being is being maintained. Now, so that is how, this is just an example I said. So this is how your health is being affected through your thought process, through your emotions. If somebody is, let me put it again very simple. In the morning you're getting up, you're so fresh, you're doing yourself a perfect makeup with a nice dress and good cosmetics and everything. You just go to your office, somebody suddenly, randomly, someone the early morning after wishing you good morning, he or she asks you, Ma'am, are you not well? You look a little dull. And I say, no, I'm perfectly all right. Maybe unfortunate, it is so unfortunate that after some time, again somebody asking me, Ma'am, you look a little dull. The charm is missing in you. Every day you used to be so enthusiastic. Today that charm is missing. Then again I said, no, it's okay. But if the third time somebody asks, really I will think, do I really have a problem? Because why that everyone is asking, probably I am not. So what I do, I go to the restroom, I look myself in the mirror and I'll say, yeah, I look little dull only. So by the end of the day, I'll get a fever. Probably this, most of you would have experienced it. So it is not that my health is getting affected, that affects my thoughts and my emotions, my physical, my interactions, and overall my energy system. It is the other way around also. Because of my thought process, because of I am emotionally upset, that results in my physiological conditions, that stops my, and overall my health is getting affected. Now, how I am going to relate that with, because I gave you simple examples. Now, how this is going to affect my health during this pandemic is that 90% of the time, by looking into the newspapers, or every now and then, you are continuously getting some messages about the COVID-19. Every day it keeps changes. So my thoughts are getting affected. I am emotionally upset because of hearing all this news. Somebody very close to me now has got tested positive. You know, somebody was saying the most positive word which was used in this era was negative, because you felt very happy when you heard the word negative, right? So now I'm looking into the 24/7, I'm looking into the newspapers. Even if I don't want to read the newspaper, even if I don't want to hear the news, somebody or other sends me in WhatsApp. So I need to read it, and that will be forwarded from many groups. Now I don't have any symptoms at all, but continuous reading all these things, psychologically, I will feel that, oh, I do have the symptoms. Yesterday, my mother cooked something. I couldn't taste it properly. They say that is one of the symptoms, you know, the taste, you don't smell properly. All your senses will become like, oh, probably I might have ended up with, I don't know. So this is how your psychology is affecting your health. Now, apart from that, there are other factors. What has happened because of this? So my thought, there is a problem with my thought process, there is a problem with my feelings, there is a problem in my physiological conditions. So overall, my energy is dropped. These things results in your anxiety, irritability, stress, depression, and loneliness. At least one point of time when suddenly they have announced a lockdown. Of course, now we are used to this lockdown. Last year, when during this March, or maybe the same month, when this lockdown was continuing, most of us because I too got many cases of stress, depression, and anxiety, anxious about whether I have COVID. If I have a COVID, what will happen? Will I survive? Because they say there is no medicine. Of course, now you have a vaccination. Last year we didn't have a vaccination. So what will happen? It's very uncertain. I just live in a very uncertain world. So it created an anxiety. I was feeling so irritable. Irritability, yes, stress, depression, loneliness. I normally don't want to use all these negative terms, but yes, of course, these are all the things we have undergone, as most of the individual have undergone. Now, what happened to my mental health? The mental health, I can test myself whether my mental health is stable through these three important things: my physiological symptoms, my cognitive symptoms, and my behavioral symptoms. So my physiological symptoms, how it without any reason, because there is a problem with my thought process. There is always a muscle tension because I'm keeping, due to the stress, I'm activating my sympathetic nervous system always, which is responsible for the fight or flight responses. So always I'm ready to fight. Or otherwise I'm ready to flight. So I'm keeping my body in the alert mode. So which results in the muscle tension. Every time I have a headache, and every time I feel so fatigued, drained out. Totally I'm drained out. I could not do anything. These are all the physiological symptoms. Because of there is an effect in my mental health condition. It is not just these physiological conditions or due to the organic reasons. Without organic reasons, my mental health was affected, and that's the reason I could able to sense always a tension, muscle tension, headache, constant headaches, and fatigue. Cognitively, I also got affected because there is a confusion. I always stay in a confusion. There is a constant worrying. I get distracted always. I am not able to attend to something, and then that resulted in the memory problem. Behavior, what was the resultant in the behavior? I had a conflict with everyone. You know, very interestingly, since I'm in the counseling, the last year, there was a lot of husband and wife issues. Because all these days, wife will go for work, husband will go for work, they will meet at least hardly for 3 to 4 hours as they awake, and of course 8 hours they will sleep, there's no problem. Everything was going very smooth. Or even if it is a housewife, the husband will go, and of course they will come back. Now the problem is everyone was at home, husband, wife, and children, 24/7. Because of all these things, there was a lot of conflict. It is a fact, because I had a lot of cases, and there is a lot of marital conflict happened. There's a lot of conflict between the parent and the children. That's all because of the confusion which you are getting. And there is a lot of problem with eating and sleeping. People could not sleep because of anxiety. What will happen? What will happen next? Isolation, procrastination. Because of uncertainty, I don't want to do anything, because why should I do? What is the point of doing? Okay, let me do it tomorrow. Okay, let me do it tomorrow. And of course, alcohol was not available for quite some time. Once the alcohol was opened, you know the statistics. The statistics was very alarming that within a day, some crores together sales were happened for alcohol. And people started buying in a bulk and keeping it at home. And these are all the behavioral reactions we encountered during this pandemic situation. Now, apart from that, the social factors, because I, as a human being, I cannot stay in loneliness, and because I'm a social being. Though I am an animal, a human being is also an animal, but I'm a social being. I always want to be, because evolutionarily, my brain is being made such a way that I always want to be in a relationship. I always want company of others. Now, what happened is that it was a total isolation, and there is a stigma. If suppose imagine that I have been tested COVID positive. Now I went to hospital. I am getting admitted myself, but no one comes to meet me. Now everything is okay. Now I have been tested negative. I've come back home. All these days, my street, there are at least some 20 people are there in the street whom I used to interact very nicely. Even for all those functions, there will be a lot of get-togethers. Everyone used to, for the courtesy sake, they visit. Because in general, in our culture, we expect, no, when somebody is admitted in the hospital, you should go and visit. You should tell them a nice words, okay, don't worry, everything will be all right. But now what happens is that I feel that I have been stigmatized because people are not coming and meeting me. Though cognitively, consciously, I know the reason because everyone is scared, but my emotional brain is not ready to accept it. My logical brain is ready to accept it. Okay, because of this COVID situation only, they're not able to come. But still, my emotional brain dominates me, and that is why they were all, see how nice I was to all these people. I used to help them a lot. See, now I'm suffering. No one visited me hospital. Okay, leave it, let them not visit hospital. Now after coming back home also, no one wants to come and meet me. I feel I think there is a stigma. Oh, you have tested positive. So I feel very isolated. The connectivity was missing. The connection was missing because of all these things. And there is, of course, uncertainty was also prevailing. And the situation is so ambiguous and it's very, very, very complex. Now, because I am thinking all others are very significant to me. I'm seeing all these things come by significant others because I'm feeling my friends. I'm so connected to my friends. I'm so connected to my relatives. I'm so connected to my neighborhood. I'm feeling that these are all the significant others in my life. They're all important. Now, I'm facing the negative reaction from all these people now. So how am I going to solve it? So everything was a problem. This, I don't know. Nobody is able to say that when this situation will be completely all right. The completely word within quotations, because it's not sure that whether the completely I can say myself, oh, there's no corona at all. I don't know. But however, the situation, people say that in the other part of the world, the third wave already started. Now India is likely to face the third wave. So all these things, whatever I said, all these problem with the thought process, problem with the behavior, problem with the conflict with the interpersonal relationship, definitely, at least to some extent, these are all going to get continued. There is no point of talking. Me as a positive person, I always feel there is no point of keep on talking about this. How I am going to manage? It is not only for this pandemic. It is not, I'm not going to address only for this COVID-19 situation. I am going to address this as a whole. How my psychological well-being could be maintained, how my psychosocial well-being can be maintained, and this can be applied at any point of time. It's not only, that's how I prepared my talk. Because I don't think so. Now people may think, oh, it is only applicable to the pandemic. After pandemic, okay, I can stay whatever, however I want. So it's not like that. So the next few minutes, what we are going to see, or maybe for another half an hour to 40 minutes, we are going to look the management part of it. How I am going to manage these problems. How, or maybe I'll put it in this way, how I am going to manage myself to maintain a well-being, overall well-being, psychosocial well-being. What are the aspects to maintain the psychosocial well-being? Right. So what is well-being? So the well-being is it's a dynamic concept. Why it is a dynamic concept? It is based on the situation. It keeps changing. But however, these things remain the same, which include subjective, personal, internally how do I experience, social, and psychological dimensions, as well as health-related behavior. So when I say a well-being includes my subjective, as I said previously, it's my subjective experience, internal feelings. How do I feel? Am I feeling happy? my social, my interactions with the other people, my psychological dimensions. Am I stress-free? I don't have any anxiety. How do I feel about myself? And other physiological health-related behaviors. Now, when I say psychosocial well-being, this particularly, there are a lot of psychologists who talked about many aspects of well-being, but this particular aspect of the 6 different dimensions of psychosocial well-being was given by Riff. So I have taken the concepts from him. So psychosocial well-being includes self-acceptance. So what do you mean by self-acceptance? Whether I have a positive attitude about my own self. As a human being, we are all actually a human being. We are not God. So being a human being, I have my own positives and I have my own negatives. How far I am going to accept it, the self-acceptance, which is very, very important, the attitude towards myself, that is self-acceptance. Of course, in detail, we will look into this in the coming slides, how to improve the self-acceptance. Positive relationship with others. As I said, we are all a social being. Without the interaction of the other people, I cannot survive. So how do I maintain a relationship with others? Satisfying and trusting relationship. It is not simply a relationship. I have, of course, if we open the Facebook, somebody was telling 5,000 because that is the limit. I could not accept people. But out of this 5,000, with how many people I have a trusting and satisfying relationship? I should feel that I can vent out anything or everything to him. There should be someone to open up. That is what is called a positive relationship. Autonomy. Autonomy is how independent I am. How independent I am in making decisions. How self-determining I am. And mostly, is it possible for me to resist myself with the social pressures? So it is not that people are doing that. Am I having that urge to do that? Everyone is poking their, or maybe there, of course, with a lot of changes in the cosmetics, a lot of changes in the cultural. Somebody may prick here, somebody may prick here. So am I doing that just by copying them? This is a simple example I said. So this autonomy is the regulation of behavior from within. And do I have that self-resistant behavior? Environmental mastery. How well I am managing my environment. There are a lot of situations. My situation demands me many things, but do I have the competency in managing the environment? Purpose in life. Do I have a sense of purpose? See, even in many counseling situations, when I ask somebody, what is your life goal? Or maybe you can ask yourself, now this is 2021. After 5 years of 2025 or 2026, how do you want to see yourself to be? If you answer it, it means you have a purpose in life. You have a meaningful goal. You have a sense of direction. But without that, there is no, it means that I don't have any purpose in life. There is no purpose for my survival. So you should have a purpose in life. Personal growth. I was 10 years before, my age was this. Now after 10 years, my age will definitely increase. That is not a growth. A personal growth, is there any difference of what I was 10 years before and what I am now? Do I have that emotional development, or in other words, am I matured, aging gracefully? There is a sign of maturity is there. I cannot behave like an adolescent, right? So if I'm behaving like an adolescent, then I don't have a personal growth. So by the end of this, now why I'm saying all these things, a self-acceptance or a positive relationship, autonomy or environmental mastery, is that if you feel, now you ask yourself these questions. Do I accept myself, or always I'm quibbling? Or maybe I will give you an exercise. Probably this is not a workshop, I am not able to make out. If you have time, maybe you can try this. Take a sheet of paper, A4 size. Okay, fold it into two halves. One column, write it as strengths. The other column you write as a weakness. You see how much strength you feel. Oh, I'm good in this. I'm good in this. And no, this is my weakness. If you write, I definitely challenge, because this has been done in research, and of course in the counseling sessions also we have seen this. Most of us, if you write 10 positive about you, you will write 100 weakness about you. Of course, I don't say everyone will do like that. If there is a well-being is a problem, definitely you will be ending up in writing a lot of weakness about yourself. It means there is no self-acceptance with you. You always scribble, yo, I don't have this, I don't have that, I should have improved that. Because there is 3 different types of selves: perceived self, actual self, ideal self. So what is it, perceived self? Perceived self is what I think about myself. What is the capabilities I have? I may think myself to be a Janaki who sings very well, but not necessarily that should be actual self. Actual self is what is the reality. I'm singing like a donkey. Maybe that is the actual reality. But I perceive myself that I'm singing like a Janaki. Right? Just a simple example I'm giving you. Then ideal self. I want to become like that someone. I want to be a Mother Teresa. I want to be like a Abdul Kalam, because I am fascinated towards the characteristics of what he holds. I feel there is something lagging in me, so I always strive to have that ideal self. Now the problem comes is that in the self-acceptance is there is always a clash between the perceived self and the actual self. Actual self and ideal self. Perceived self and ideal self, and that's end up with the problem in your well-being. So we are going to look how I am going to practice it, or how I am going to enhance my wellness, well-being. So practicing wellness. So how can I practice? Well-being is an act of practicing healthy habits on a daily basis to attain a better physical and mental well-being. So now how do I practice wellness is that, because I said already, I have given you, if I feel all these things, yeah, good, I have my good self-acceptance, I have a good relationship with others, I have a lot of freedom for myself, I can manage any situations, yes, then your well-being is perfect. But for which, what you should do is that the first topmost priority is that you should have a healthy habits. Especially most of us, we ignore our body, right? So being from Tamil Nadu, I definitely would like to quote sayings who is a great Rishi Tirumular. What he has said is that, I'll say in Tamil, of course I will translate that in English. Ullam Perunkovil Unudambu Alayam Vallal Piranarku Vai Gobura Vasal Tella Telindarku Jeevan Sivalingam Kalla Pulanaindum Kana Manivilakke. This is one then, and the other one is Udambinai Munnam Idukendrindeen Udambinipulle Uruporul Kandeen Udambinulle Uttaman Kovil Kondan Endru Udambinai Yanirundu Ombugindrene. I'll translate this. See, what he says is that my body is a temple, right? If irrespective, I'm not talking about any religion here. In general, it can be, you can assign yourself whether it is a temple or a mosque or a church. What he says is that your body is a temple. If it is a temple, if you will keep your temple very neat, very clean, make sure that there is nothing affects that inside. But the reason how it gets affected is through my sense. The 5 sense organs, you know what are the 5 sense organs. So these 5 sense organs you have to keep intact, so that through which your body well-being is maintained and your mental well-being is also maintained. That is the moral of these 2 poems. I don't want to explain it more. So the moral is, you treat your body as a temple. When you feel that your body is a temple, definitely you are going to keep it clean. It doesn't mean that outer cleanliness, the inner cleanliness. So the inner cleanliness will come only through the best habits, maybe through physical exercises, good eating behavior, with all those stuff. So how do I going to protect my well-being? So these are all the tips. Take care of your body. I'm sorry, I think there's a printing mistake. So take care, it's not R, it's care. So take care of your body, which is the topmost priority. Even, see, I ignore my health. I just ignore my health. I always think about something else. People are least bothered about. They treat their stomach as a garbage. Literally, I am not hesitant to say this here, because there are many people who just dump their stomach with food. There is no difference between a garbage. Of course, that's the reason that I always love naturopathy and yoga, because that always talks about the internal body cleansing process, how to cleanse the body every week, maybe the fruit diet or a water diet or a fasting. So you have to take care of your body. You cannot expect, then if you fall sick, you cannot blame others. See, the same principle even in the COVID situation also. Everybody is preaching about our yesteryear's practices, that how we were taking care of our body, how healthy food we were eating, how we were maintaining the immune system. We are talking about taking vitamin C, we are taking about zinc, we are taking about ginger, garlic, etc., etc. So at the end of the day, it is all how you take care of your body. That's the reason in the protecting your well-being, the first priority is to take care of your body. Then of course here, because we are talking about the body, I should talk about the obesity. Many youngsters nowadays, they suffer from obesity, and I have personally seen, I have spoken to the doctors who are treating the COVID patients, many deaths correlated with obesity. So you need to take care of your body. That's the top priority. Then value yourself. I put it in the other way. If you really take care of your body, it means automatically you are valuing yourself. If you're not taking care of your body, it means you don't value yourself. You are not connecting with you if you're not taking care of your body. The third is, you should surround yourself with the positive people. Please stay away with the negative people. Now the next question comes, madam, how to identify the negative people? When you say something, for everything they say opposite thing. Okay, maybe for example, you might have seen people say general as a customary question we ask even in WhatsApp, or even when I look into the people or in the Facebook. Hi, how are you? How are you doing? So what generally you will answer? Can put it in the chat box. I'm good. Yeah. Fine. Yeah. Fine. Right. Excellent. And you. Yeah. Fine. And you. Right. So you can try. Now this maybe to improve your well-being. Next time onwards, you try to collect a lot of adjectives rather than saying fine, good, nice. Wow, superb, exuberant, abundant. Why can't you use this adjective? Since somebody is stopping you? No, right? So try to find out cool. So you can use a different adjectives which always boost yourself. But there are people, these are all normal people. I'm talking about the normal people, because now we are talking about the positive and the negative people, right? Of course, when I say I'm good, I'm fine, nice, super, excellent, these are all the positive. Oh God, why you ask? I'm not well, yeah. Oh, since you're asking, I'm telling all these things. So it means These are all, they are all negative people. Please stay away from them. Then the next day onwards, you will never ask them how are you, because you would have fed up with the answers, the variety of answers you got it from them. So try to identify these negative people and please try to stay away from them. Give yourself time, especially for, I say it for the women. Women, they grumble that what is that I'm doing work for my children, I'm working for my husband, or I'm working for the day where I am, nobody is asking about me, how are you, I'm not doing anything. Nobody stops you, right? You spend time to yourself. When I say give yourself time, you do at least once in a week for half an hour, whatever you like. You like dance, I'm just saying, to the extreme case, I'm just saying. Close the door, play the music, dance for half an hour. Nothing wrong in that. Somebody is so excited when I say dancing, right? It means you will have a satisfaction. Yeah, I've spent time for myself. Then learn to deal with the stress. Of course, since it is not the stress management class, I'm not going to talk much about it. Of course, through the better lifestyle, changing your lifestyle. I'm not promoting your naturopathy, but since I am a follower of naturopathy practices, I'm just saying that if you practice this nature cure or following the principles of naturopathy, definitely you can deal with the stress, because one way of dealing with the mind is dealing with your body. Quiet your mind. Racing of thoughts. People sometimes, they have a racing of thoughts. Thoughts keeps coming. They are unable to fight their mind. So practice yoga or meditation, pranayama. You can fight your mind. Set realistic goals. The goals should be very realistic. Maybe since I am a professor, I would like to quote the example of the students. The students, they have an unrealistic goals. How do they have unrealistic goals? They will have, probably their exams would have been announced. They see, oh, 10 days I have. I can do wonders in these 10 days. Okay. Then, like that, every day will go. They'll just put a fine, nice timetable. They'll say, okay, I'm going to follow all these timetable. So, how they make a timetable is that in a day, because they have only 10 days, all these days they have not studied anything for their exams. Now only 10 days will be there. So at least in a day, 2 to 3 lessons I should finish. So I'll work out a timetable as 3 lessons per day, because from the first letter till the last letter I should study, because I have never opened my book previously. Now I have set a goal that every day I am going to finish it off. But definitely you will not be able to, because you are going to open your book for the first time. You will find it very difficult to close it. So every day at least one lesson will be pending. So you will postpone that to the next day. Then also you will be overconfident. Say that even if it is one day is there, you will not say one day, 24 hours I have. Okay, that is an unrealistic goal. So 24 hours, maybe it sounds good. It looks like a positive attitude, but it is something unrealistic. Break up the monotony. The main reason for getting fatigue or a boredom is that every day the routine, the same routine. Every day the same routine, getting up early in the morning, drinking coffee, going, coming back, sleeping, eating. It's this monotony gets bored. No, suppose, so try to break up that monotony. If you're traveling in a bus, why can't you try to change that and go by a train? Or why can't you take up a walk? Get up early, go for a walk. If it is nearby, avoid your car or a two-wheeler, go for a walk. Just a simple examples I'm giving. So like that, you can think about yourself and you break the monotony. Focus on one thing at a time. Don't look into for the multiple things. People, you cannot say that I'm a multitasker. I can do 10 things at a time. No, it's impossible. As a human brain, it has a capacity to do 100% perfectly only one thing. Of course you can do. I don't say that you cannot do multiple things, but 100% result, only one thing you can get. And definitely have someone whom you can trust, whom you can open up all the things and share. So the next, Positive signs of well-being. So what are the positive signs? How can I say myself, yeah, I have a good well-being? If you love yourself. Every time, it may be, these are all I would have put it in a different words or a different jargon, but everything conveys the same. Self-love. Self-love, it means you love your own physical body, you love your own emotional body, you love yourself, how do you deal with others. So you love every aspect of yourself. And also you should have a sense of self-control. If you love, yes, you can just pat yourself and say, yeah, I think ma'am said, I have positives. My well-being is good. My well-being is excellent. Sense of self-control. Tolerance. And sometimes if it is a repetition, I'm not going to explain it again. A sense of self-control. A sense of self-control. How do I okay, let me put it in with a different example. You're getting up for the office, or maybe you are getting up for the work or something. You're getting ready yourself. You're dressed up nicely. You are about to leave. So if somebody is your mother or you can relate yourself, your child or somebody just dashes on you so that the coffee, whatever she or he has, spills on your dress, spoils everything. How do you react? How do you react? First reaction, the immediate reaction probably. What is the immediate reaction? One has a reaction, huh? Angry. Yeah. Then, so what do you do with, yes, of course, everyone gets anger. What do you do out of anger? You will beat them, scream, throw things. What's the behavioral reaction I'm asking? No behavior. You're all Shanta Swarupi, sir. I don't think so. Everyone is so Shantam that you will maintain a cool, okay, no problem, you please go, I'll take care of myself. No one is going to do that. So definitely you're going to do, either you're going to hit or you're going to scream or you'll scream instead of, if it is a daughter or a son, you will scream your wife or husband, why you allowed them to do like this? As if it is their mistake. So some reaction definitely will be there. So now the sense of control is that I don't have a control over the situation. Even the child or a wife or a husband definitely would have not expected this will happen. But what is there in my control is that how do I react? That is what we saw in the beginning. So 10% is happening, but 90% is based on what we react to it. So if you have really a sense of control, you of course, on a spur of a moment, definitely you will react to it. But afterwards, if you're taking it, and the whole day will get spoiled. So try to have a sense of control. Think whether it is under your control. If it is under your control, there is no problem in getting anger. But if it is out of your control, you have to control yourself. Then tolerance, it is something similar to that. Engaging in meaningful activities. You know, most of the time, this again, I will give you an assignment for you. You can do it and check how meaningful activities in a day you are doing it, or how much hours there are time killers are there. You're wasting your time. So what is the homework you have to do is that take again a sheet of paper. Suppose you are getting up 5 o'clock in the morning. Probably I'm telling very early. Whatever may be the time, 8 o'clock, 9 o'clock, 10 o'clock, right? So write time from the time till you go to bed. Even if you go to restroom or eating, walking, everything you write. And see, there will be a lot of gap. You'll think, what I have done? I've not done anything. So it means you're not doing anything meaningfully. So try to engage yourself in a meaningful activities. Forgive others. It is definitely a positive sign of well-being. If you don't forgive others, people say, I forgot that. But forgetting is not important, but forgiving is very, very important. If you carry that hurt feeling, then your well-being is getting affected. People who have hurt you, they would have been enjoying, but you will be repenting for it. So try as far as possible, try to forgive others. Please feel very grateful for whatever you have, rather than thinking about what I don't have. And sense of humor. Yeah. So the sense of humor, now, with most of us, it's missing. The sense of humor is missing nowadays. People, even if we crack a joke also, they'll think, oh, it's a joke, I should laugh. So try to develop a sense of humor. Not that there is no age limit for having a sense of humor. You can always have a sense of humor. Probably I may tell you a small story which is related to this sense of humor. There was one guy who was eating these tube lights and bulbs, which we used to put it all these LED bulbs and tube lights. So people are wondering, why you are eating tube lights? Then that fellow, he said, no, I went to the doctor. Doctor gave me a diet consultation. He said, you take something light. Keep eating light. So he started eating the light itself. If some people could understand, you have a sense of humor. If you don't laugh, you don't have a sense of humor. That's all. Okay, next. So what we are going to see next is the rituals of life. Why I quoted this as a rituals of life is that, what is rituals, by the way? Then only you will understand this. What is a ritual? Have you ever done any ritual or some rituals which has been said by your grandparents, parents? Any ritual? Can just for an example. Any rituals you are following? Until I get answer, I will not be able to continue it. What is a ritual? My God, nobody knows. All those practices, traditional practices we used to do. As you get up in the morning, you should worship God. You should say namaste, something. Yeah. Right. So these are all the rituals which we do it mandatorily, right? Ritual like praying God or doing puja, or maybe when during the puja time you offer something to the God, right? So these are all the rituals of life. Now these tips, what are the rituals of life I am going to give is, yeah, Friday we used to fast and pray. That's a ritual. Yeah, correct. So like that, I am going to say some rituals. Why I am saying that as rituals is that, feel that I should do it every day. I should make it as, if you feel that it's a ritual, then only you will do it. Otherwise, you don't do it. So ritual of solitude. Spend some time loneliness. Don't talk to anyone. Stay calm, stay cool. Just stay simple, simply closing your eyes without any thoughts, without anybody nearby. So stay in solitude. Make sure that in the 24 hours, at least 10 minutes, you stay in a solitude. Then, ritual of physical exercise. People have lost the habit of doing a physical exercises. Please start doing physical exercise. Make it as a mandatory. Then, ritual of nourishment. When I say nourishment, I'm talking about the healthy eating habits. Okay, again and again and again. Though I am a psychologist, I am always talking about the maintenance of body, because mind-body relation, many people, they are not talking about it. I cannot say only about the mind. You take care of your body, your mind automatically takes care of yourself. So physical exercise and nourishment is very important. Ritual of abundant knowledge, because I should give, as I said, what is mind? My thought process, my emotions, my physical body, everything, energy together is mine. So when if I want to take care of my brain, then, which is a hardware, because we think whenever mind, it is here. Brain, probably it is a seat of thinking process. Make sure every day, half an hour, you read new things. What I have learned today. So half an hour every day, 24 hours we have. So 8 hours sleep, 2 hours eating, another 2 hours to getting ready yourself, rest also, then also you have a lot of hours with you. So make sure every day, half an hour, you read something which takes care of the ritual of abundant knowledge. Ritual of personal reflection. Every day before you go to bed, rewind. Rewind what has happened today. Probably here I will add something. Have I made anybody to smile? Yes? No? No. Okay. No, it's not a problem. Have I made anybody to feel very sad? Then you need to change yourself because you are reflecting. So make sure that at least in a day I make some person to smile. If you have a sense of humor, definitely you will make somebody to smile. That actually gives a lot of energy to you. Ritual of early awakening. This I wanted to underline it with a red ink because most of the youngsters, they don't have the habit of early awakening. Early awakening, like they might have never seen a sunrise. How many of you agree that, yeah, every day I see a sunrise? Of course, in summer it is a little early. So make sure you get up. If you're getting up at 8 o'clock, at least make sure half an hour after attending this lecture, at least by 7:30 I get up. Ritual of music. Music is the best healer. I say this everywhere, even to my clients, those who are coming for the counseling. I tell them, please listen to music. In a day, at least you do something, let the music play in the background. Not necessarily you should be well aware of Carnatic music or Hindustani music, ghazals, not necessarily. Some nice music, because there is a lot of connectivity between music and emotions. It could able to create a lot of emotions. That's why when you hear a love song, you feel like you are fallen in love. So which is very simple, that music as a connectivity. So make it as a ritual, that listen to the music. Ritual of spoken words. Why? What is the spoken words? You be conscious about what you are speaking. Don't say that, oh, sorry, I thought of telling this, but instead of that, I told this. There is no point in talking like that. So you be very careful in the words you use. Make sure that it doesn't hurt others and doesn't hurt yourself. Ritual and congruent character. See, the congruent character is that how I am maintained. Let me give an example. Okay, now you are attending to all this my lecture or whoever's lecture. It's very fascinating. You get a wow feeling. Wow, nice, no? I should have practiced this. I can practice this. These all looks to be very simple. Then the next day with full of energy, you will get up at 5 o'clock or will get up by 5:30 and you said, okay, ma'am has said me to spend in solitude. Let me spend solitude. Let me take a book, read for half an hour. Okay. You do that for 2 days. The third day, some important work will come. Then you will, okay, today let me give an excuse. Yeah, no problem. Let me not read today. Then the fourth day, you will skip one more thing. Then slowly it will vanish. So the congruent character is that you be what you are in all the time. It should be easy for somebody to predict your behavior. You see, it is very difficult. Suppose I am working under a boss whom I feel that, oh my God, I cannot predict my boss. When he will shout, when he will smile, when he will appreciate, we don't know. You cannot live in an uncertainty, right? So the same thing I should also not create. To have a congruent character, the ritual of simplicity. Yesterday also I was reading something. Everything is simple, but living simple is difficult. But that is also very easy. Simple is also, if you follow all these rituals, definitely living simply is also very, very easy. Right? Then, well-arranged time is the surest mark of well-arranged mind. This again, if you have noticed my lecture in the previous few hours, every time I was insisting about the time. So a well-arranged time is definitely a well-arranged mind. So you no need to worry about it. Then again, there are a few more tips is there. Apart from the tips, whatever I have given, you have to master your mind. Dr. Naveen, do I have another 10 minutes extra? Because it's almost 3:30. Can I extend it?
Yeah. Please move on, madam. No problem.
Thank you, doctor. Yeah. So coming back to the continuing of the tips, how to maintain your psychosocial well-being. Master your mind. Master your mind. I think that I should take another separate workshop for it. As of now, if you take care of your body, definitely you can master your mind. You follow your purpose. As I said in the beginning, there are 6 important dimensions of your well-being. So that in that one dimension there is a sense of purpose. I should have a sense of purpose in my life. So set some goals, a short-term goal and a long-term goal. Without any goal, you cannot move on. If you're getting ready, you're planning for the trip, okay? So you will see that which bus goes there, or is there any train available, how I'm going to book a hotel, how I am going to eat, how much money is required, everything you do it. For a simple holiday trip, you plan so much, but an entire life of 60 years, you don't plan. So you set a goal, a meaningful goal, and you follow that purpose. Practice Kaizen. Does anybody knows what is Kaizen? Anyone knows what is Kaizen? Actually, Kaizen is a Japanese concept. Yeah, right. So Kaizen is a Japanese concept which says that a small increment would lead to a major success. It means you're attending to this class. Okay. There are so many things I said. With all these 14 to 15 slides, and keep talking for an hour. It is not possible sometimes as a human mind. It may not be possible for you to follow everything. But definitely there are something which would have hit you. Oh, I think this is very easy. I can follow it. So if you start bringing a small change will lead to a heap of a change. Like small steps will lead you to go to a mountain, right? The same way the Kaizen is simply like that. We bring a small change. Next, you bring a small change. So these small changes will lead to the better. So try to practice that. Live with a discipline. A disciplined life is very, very important. Like how in yoga they said yama, niyama and all. So try to follow all these things with strict discipline. Respect your time. I don't want to repeat it because every time I'm talking about the time. Selflessly serve others. Why I have included here is that when I say about the social well-being, when you help others, when you see a smile on their face, right, which will indirectly helps to release a lot of happiness inside you. I'm taking care of my body, I'm taking care of my mind, but more than that, if you help someone, which brings a greater satisfaction in you, that actually will result in a very good well-being. And embrace the present. Don't try to live in the past. Don't try to live in the future, because past, you cannot go. You don't have a time machine to travel. Go back, set the time, come back. Of course, in fictional movies, you might have seen all those time machines. It will be exciting. Oh, it will be very good, no? All these movies also, God will appear in front of you. It will ask, if I'm giving you a thing that you can change something, what you would like to change. Why you want to change? So don't live in the past. You cannot change anything of your past. And future, you don't know. Future, you don't know how it will be. So live in the present. Today is the moment. How I have lived today. Today morning I lived perfect life. I took care of my body. I took care of my mind. I've taken care of my kith and kin. I made somebody to smile. So live in the present. Many people, the problem for the which affects the well-being is that either they live in the past or they live in the future. They fail to live in the moment. I still remember there was a photo which has been sent in WhatsApp. Aishwarya Rai is coming. So everyone now it's become a fashion, not take a selfie. People they say that even with the dead body they take a selfie. It has become like that. So this you should think about Aishwarya Rai. So when Aishwarya Rai comes, all these men, they were so crazy about Aishwarya Rai. Everyone is running and trying to take a selfie. Out of which only one man, he was just admiring her, which is a simple example of living in the present. See, when she is there, you admire her rather than wasting your time and taking up the selfie. Okay, maybe I'm a little crude about my talk, but that's a fact. Happiness. So with all these things, what I do end up, I would like to be very happy. And these are all the things which is already I have shared. I just rush through because again it is going to be a repetition. Exercise, meditate, be honest, dream big, be patient, judge less. This point alone probably I have not explained. I try to explain it. Judge less. We always try to judge a people, right? Suppose I'm walking now. I've fallen because there was water. I didn't see that water. The floor was very slippery. I have fallen down. Then I say, who's that idiot who has dropped the water on the walkway? But if somebody is falling down, then I'll say, you don't have any eyes, sir. You're seeing, no, there's a water inside. Why can't you look and walk? So don't do that. You don't judge others. Because as a why I am not given here as don't judge. As a human being, we are all human beings. After all, a human beings. We are all Atma, not Paramatma. So for this normal Atma, it is a usual thing that I judge. Let's try to reduce it. Smile often. Keep smiling. Again, I'll give you an exercise for you here every day morning as you get up, you brush your teeth, look into the mirror, smile to yourself, keep smiling, right? As more smile more, don't laugh, okay? Love yourself, show gratitude. Again, one extra point here is that drink lot of water. Not necessarily it only in the summer, because the water has a cleansing property. Water has a lot of properties which will help you to maintain a well-being. So drink lot of water. Believe in yourself. Keep an open mind. Put yourself needs first. Don't make excuses. Speak well of others. See, this is again very important. If somebody is asking about someone, you don't like them, even if you don't like them, you speak well of about when in front of others at least. Listen to understand. Please cultivate the habit of listening. People, see the communication, a good communicator will listen first, then only he will communicate. If you are not listening, then you are not a good communicator. So these are all the important tips to improve your happiness. So I will end up with this says, accept what you cannot change. Change what you cannot accept. This is both or the same, almost the same thing. So accept what you cannot change. There are few things in your life which you cannot change. Can you change this COVID-19? No. Can you change this lockdown? No. So accept what you cannot change. And change, if you are able to accept it, okay, this is right only, no, what they are saying, then you change it. There is no point of telling I accept it, but I don't change. Right? So with that, we have come to the session. Probably if you have any questions for another 5 minutes, we may have a question and answer session. And thank you so much for all your patience listening. Hope I have not bored you. Yeah. Yes, Dr. Naveen.
Thank you, ma'am, for that wonderful session. If there are any questions, you can ask or you can post it in the chat box.
Thank you, madam. Thank you, madam. Any questions from the participants? Any questions from the students?
Good. If you ask students, only two possibilities are there. Either they have understood everything very clearly, or they have not understood anything.
I think they have understood everything, and
because we are positive people, let us stay positive. We
yes.
understand everything.
When they meet you, that time I think they will have many questions to ask you. And yesterday I was telling to our students, I think a couple of days before, because as you know nowadays, truth telling students are very, very less, and even life has become like that. If you say truth, you may not get the desired benefit or recognition. So sometimes they tend to say lies. So I told them maybe we will have some positive reinforcement. Those students who say truth will be given some prize. So what is your thought on that? And one more thing is, if we are true to our inner consciousness, then we don't deplete our energy.
True.
If we are not true and friend something back something, so we are going to deplete our energy. What is your thought on these two aspects? Thank you.
Sir, I have a question.
Doctor, can I just question, Doctor? I don't know whether
Yes, sir. Please.
you agree to this point. During this COVID period, the vulnerable group, so I feel the vulnerable group will be mostly affected. The psychosocial effect will be more to this vulnerable group. Vulnerable group mean those with anxiety personality. Before the COVID, those with the anxiety personality, the issues with the relationship issues, those with the what do you call mental health? Like depression. All these are vulnerable group. They definitely their self resistance will be very low. So high possibility for them to affect by the fear. Because I come across many people, even they are top highly educated, they are fear of the vaccine. They avoid vaccine, and that particular person, very top person in police force, is end up in COVID positive. That person told me, because I fear of the injection, I thought I won't be affected because mostly I stay at home. But I made a blunt mistake is not putting the vaccine because due to the fear factor. Although top person, because their personality, the fear factor is there. So this type of vulnerable group will be mostly affected. As what you say, wonderful presentation. I think this message will definitely help others. Thank you, including me. Thank you.
Yeah, thank you, Guna sir. Thank you so much. Yeah, as he rightly pointed out, already I have a personality problem. Already I'm anxious. I have KB, so definitely it will be more worsened condition. So we are not touched upon that how we are going to deal with them, because that is actually entirely a different topic. Yes, but that is a valid point that though I am already a person with a problem with a personality disorder or anxiety disorder, definitely it is going to worsen the situation. And with related to the, since he has just told about the vaccination, I would like to point here is that as far as vaccination is concerned, of course, fear is one factor, but not the only factor. People are not much educated about the consequences, and they are not well aware. The information, the knowledge is the problem. Whatever the knowledge they have about all these things, it's either a wrong one or very less. So probably if that is corrected, we can help. Now yours have become international, Dr. Naveen, because there are many participants from Malaysia also. They're here.
Yeah, wonderful to hear from Malaysia.
Yeah.
Next time we will make it as international symposium. Now national symposium.
Yeah. Okay.
Yeah, thank you.
So there's no questions. We can.
Tejaswini, she has asked some questions.
Yeah.
What she has asked? Where is it? Chat box? Yeah. Tejaswini, could you unmute yourself and ask question to the madam? Madam, could highlight on what I said? Maybe it will be useful to the students. That is the reason I asked.
Sorry, sir. Sir,
Yeah.
can I? Yeah.
Yeah, please go ahead.
Good evening, ma'am.
Yeah, good evening, ma'am.
Regarding like after BNYS, like what is the scope in taking MSc in psychology? Is it possible for us?
You would like to continue in psychology?
Yes, ma'am.
Actually, to be very frank, it's a good combination, and that's what even your principal has chosen. That he has done his PhD in Namaz. Is Dr. Naveen correct?
Yes, madam. Yes.
Yeah. So there are a lot of research has been done combining psychological principles and yoga. Especially, a lot of interventions were given. So it's a good idea. After BNYS, you can do your masters in psychology and can do research which combines your naturopathy knowledge, yoga, with the psychological factors. Of course, you can check into some pathological conditions, which could be a new, innovative one. We need people like you for the holistic healing, because people always go for allopathic medicines, right? So instead, we can show ourselves that naturopathy and yoga can also have a best cure in psychological healing. Yes, of course, you have a very good scope.
Okay, thank you, ma'am.
Dear participants, the link has been posted in the chat group, in the chat. So please click on that link to give your feedbacks on all the 4 sessions. And once you click on the submit button after giving your feedbacks, you will be receiving the participation certificate automatically to your email. So please don't miss it. So if you want the participation certificate, click on the link, give your feedback, and then receive your participation certificates.
Thank you, madam, for being with us.
Yeah.
Madam, can you hear?
Yes, Naveen.
Yeah. Thank you for being with us today on this national symposium. Yeah.
So with this, we come to the end of the National Symposium on Yoga and Naturopathy conducted by Anupaya Naturopathy and Yogic Science College and Hospital, Mangalore. It was a symposium of 4 sessions conducted from morning 10 o'clock to evening 3:30. So thank you all the participants. Thank you all the guest speakers and all the guests who have made this event possible. Thank you one and all.
So I'll leave Dr. Naveen. Thank you so much. Thank you for the invite. We'll definitely have a session, another session. Thank you.
Madam, you are saying something?
I just said thank you.
Yeah,
Thank you so
fine.
much for the
Fine.
invite. We'll catch up
Thank
some
you.
other.
Sure. Thank you very much for joining us.